Welcome to the Cannabis and Myositis presentation. I'm Mark Matosa, and I'm going to be working with Amy Green to help discuss this particular subject. Amy, tell me a little bit about myositis. I know that it's something that to tell this audience what it is kind of interesting, but let's just set a baseline so we can talk about how cannabis can help.
Sure. So, myositis is a general inflammation or swelling of the muscles. This can occur anywhere in the body, and it is contributed. It's an autoimmune disease. So, this is something where the body is attacking its own cells.
Well, it's interesting because when you look at it, it really has. We talk about chronic inflammation in the muscles, which is something that occurs, as well as pain that's associated with it. And these are two conditions that cannabis is very good at addressing.
Absolutely. Uh, Two of the things that cannabis is really great at addressing are just those two things. So, you have inflammation and pain control. Those are the definitely two big things for cannabis.
Yeah, and as we all know, there's not a lot of research that's been done on myositis, either in the cannabis world or even in the pharma world. So what we're doing is we're giving you information based on studies, not necessarily about myositis itself, but from a big body of studies that have been done that shows the benefits of cannabis. And there's studies behind each and every one of these. It's interesting that there's so many different uses for this one plant.
Absolutely. I mean, we have had studies for Alzheimer's, anxiety, stress, chronic pain, degenerative disc disease, depression, fibromyalgia, and the list goes on and on. There are just so many things that medical cannabis can help, and we're really hoping that myositis is another thing that cannabis can help.
Yes, we'll find out. Now, what's very important is it's safe to use. There's been no reported fatal overdoses in medical literature for or from the use of cannabis, whether recreationally or medically. This is an important point.
Absolutely. The safety of any medication should always be taken into consideration, even if it's just over the counter aspirin. You should know that there are risks and benefits with any medication. But luckily for medical cannabis, there have been no reported deaths associated with the use of medical cannabis.
What I find interesting is the World Health Organization says it's safer than alcohol and nutmeg, which is very fascinating. But when you really look at it, it's safer than peanuts and aspirin.
It is, and we have the documentation to show that it's safer than those things.
Yeah, I find it interesting. Now, what is cannabis? I tend to look at cannabis as what I call a whole medicine cabinet, and really medical marijuana is the key to unlocking that medicine cabinet. And what is that medicine cabinet? It's 450 different medical properties that we know of that's been studied, 120 cannabinoids that we're studying today, although we've found 200 of them, 100 terpenes being studied today, although we've found over 200 of those. So it's like this medicine cabinet that's there, but that's not really the story. The story is the terpenes and the cannabinoids working together create an entourage effect. Amy, what's an entourage effect?
Sure. So the entourage effect is when you have all of the different compounds in a cannabis plant working together. So you have all of the cannabinoids, your THC, your CBD, you have your terpenes, which give cannabis its smell and its taste, and then you have all of the flavonoids, which are just another component that's contributing smell and taste to cannabis. And all of these things working together are what provide the medical benefits for medical cannabis.
It's kind of like one and one is three type of thing. Now, what's the big deal about cannabis? Well, we all know that we have a nervous system. I tend to look at the nervous system as the cell phone system of the body. If something happens in one part of your body, it basically goes through your nervous system to your brain, says, Houston, we have a problem. And that's how your body manages itself. It knows that you have issues and it runs that through the control center, which is the brain. What's interesting is for years we studied the nervous system, but only recently, in the last 30 years, have we been studying the endocannabinoid system when we started studying cannabis. And what we found out is that when your body says, hey, Houston, we have a problem, what was Houston doing with it? Well, it was handing it to the endocannabinoid system. And this is what regulates your memory, your appetite, inflammation, your immune system. This is the part of your body that your body manages itself. It's interesting that it does so much, and yet it's just recently been found, Amy.
Yeah, it's really amazing all of the research that's been emerging on the endocannabinoid system. It's something that exists in all of our bodies, and we're just learning about it still.
Yeah. And so the reason that this is important is because your body likes to stay in something we call homeostasis, your body in balance. What's really interesting is that the endocannabinoids that your body produces to be able to manage itself is identically mimicked by the phytocannabinoids found in the cannabis plant. That's an important point.
It is. So our body is naturally producing these compounds, and when they're in our body already, they're called endocannabinoids. So it's something that we're already producing and that is already regulating and modulating functions in our body. When we are including additional cannabinoids, such as from a cannabis plant, they're called phytocannabinoids because we're adding them in. And so it is supplementing a system that naturally exists in our body.
So some of the well-known cannabinoids that are found in cannabis are THC and CBD. THC is a very important part of cannabis, Amy. Why is it given such a bad rap, but why is it so important?
Sure. So THC is going to be the most common cannabinoid found in the cannabis plant. It sometimes gets a bad rap because it can cause psychoactive side effects in some patients. I will always tell people this is dose dependent, so it depends on how much you take. So if you take a high dose, yes, you might have some psychoactive side effects. And if you take a low dose, you're probably not going to have as much psychoactivity, or you might not have any at all.
What's interesting is that when you look at 0.3% or less of THC, that's considered to be hemp. And that's the definition of hemp. And so when you take a look at hemp-based products, it typically means it has 0.3% or less THC in it. Now, CB1 receptors really work on the brain and central nervous system, hence why the psychoactive effect of THC. But CBD is not psychoactive, and it really works on your peripheral organs and your immune system, but it is probably one of the most important cannabinoids in the cannabis plant.
Most certainly. And one of the biggest things that CBD does is anti-inflammation, and it helps with pain by connecting to those CB2 receptors, which are in the peripheral organs, the peripheral muscle throughout the body, and that's how it's helping patients.
And what's really important is that in many cases, reducing the inflammation reduces the pain. And that's an important point because a lot of people will say, well, I take CBD and it's really helping me with my pain. Well, it's not addressing pain directly. That's really what THC's job is. But by reducing the inflammation, it does get rid of some of that pain. And so there's a perception of what's out there. But it's important, very, very important part of it. Now, taking a look at, this is a very limited number of cannabinoids, but taking a look at all of them working together, you can see where when you're looking at inflammation, the different cannabinoids working together create what they call the entourage effect. Same thing that goes on with sleep. You can see the different cannabinoids coming into play, THCA and CBG. You can see the same thing with cancer. There's different cannabinoids that come into play, and also with pain. This is an important part. This is really what the entourage effect is about.
It is. And so this is different parts of the cannabis plant working in conjunction with each other to provide these benefits. So say, for example, you have delta 9 THC working with CBG to help with sleep. And that when you put these things together, they help with sleep. Same thing if you combine CBD with THC, you're going to have really powerful anti-inflammatory effects, but you can also have some cancer growth limitations.
Yeah. And so this is what makes cannabis unique. And this is what makes it different from a lot of what they call the pharma drugs, where we're looking at more than one component and more than one route of administration. Now, when we talked about hemp versus marijuana, really the difference is 0.3% or less THC. That's the definition of hemp. Over that is marijuana. But marijuana is considered to have more THC in it. And really the common uses of hemp have been more for building material, ropes, things like that. Not a lot of medical use in history where marijuana has.
Absolutely. And we are finding that CBD from hemp can also have some medical benefits, but a lot of times we're looking at all of these components working together, and that does include it does include THC, which is only found in cannabis or marijuana plants, versus hemp plants, which have, again, less than the 0.3%. So when we're looking at just a hemp plant, it does have a lot of uses, but it's going to be limited by its THC content.
Yeah. And when we talk about cannabis, we're referring to both hemp and also marijuana. In other words, they're just like roses have different rose families. There's still roses that are really out there, and that's what cannabis is all about. Now, well, here's some terms around the hemp-based CBD products: full, broad, and isolate. Tell me what those are.
Sure. So I'm going to start at the bottom at the isolate. This is when you have just CBD isolated from all of the other compounds, and it's just CBD all on its own. And then that's infused into a product, either an oil, gummy, any other type of product. Now, a broad spectrum product, this is going to be more parts of the plant. So it's going to have CBD and then whatever other cannabinoids, flavonoids, and terpenes are in that plant, but it will have essentially 0.0% THC.
Now, that's an important point. Isolates do not have the terpenes and flavonoids where broad spectrum products do. And really, the health benefits of hemp or even marijuana comes from the terpenes.
Absolutely. And then full spectrum products, these are going to be very similar to broad spectrum. However, it may contain up to that 0.3% amount of THC.
Which should not be enough to get you high, although it depends on your body, and every person's body is really different. But really how cannabis works is you have the endocannabinoids and phytocannabinoids that come together and are in your body to address the CB1 and CB2 receptors. You know, there's also synthetics that are out there, but really, when we take a look at medical cannabis, we really don't pay much attention to synthetics because they really should be used only under the care of a doctor.
Certainly. And one that a lot of people have probably heard of before is Marinol. This is a substance that was created in a lab. It is synthetic THC, and its main job is just addressing lack of appetite and nausea. And this is a FDA-controlled medication that can only be used under the care and direction of a healthcare professional.
Right. And when we're taking a look at medical cannabis, this is something that you, in fact, can use, in fact, to be able to manage your appetite, pain, sleep, pleasure, sensation, things like that. Now, how this works is when you have both your body produces the endocannabinoids or you have the phytocannabinoids that are entered by taking cannabis, that gets put into your fatty acids. And that's where it's stored, like a battery. When your nervous system, the neurons, say, Houston, we have a problem, it triggers the fatty acids turning into long-chain fatty acids, and those are sent through your bloodstream to that part of the body that needs to be addressed. This is a fascinating process. I mean, a lot of people perceive that the cannabis goes directly into the CB1 and CB2 receptors, but it really doesn't. It's processed by your body and controlled.
Yeah, and so it does allow your body to modulate this reaction a little bit more. So your body may hold on to some of those cannabinoids and say, I don't need this right now, but I might need it in a couple hours. And then when your body sends the signals that there's pain or there's inflammation in a certain area, your body's reaction then is to send these fatty acids to that area and to be connected with these CB1 and CB2 receptors.
Sure. Now, what's interesting when you take a look at CBD, which is that, again, it looks at the CB2 receptor, it also does more than that. It does more than just handle the endocannabinoid CB1, CB2 receptors. It handles a lot of other receptors. Amy, it's an important, it's super vitamin if you think about it.
It really is. So the really cool thing about CBD is that we're finding that it connects to, like you said, not just the CB1 and CB2 receptors, but also 5-HT, which is a serotonin receptor, A2A, which is a receptor responsible for inflammation and coronary circulation in your heart, the VR1 receptor, which is part of controlling your body temperature and pain sensation, and then the GRP55 receptor, which is part of regulating your blood pressure. So CBD is interacting with all of these different things in your body.
Yeah, and they're actually finding out it has more than just this, but this is what they know about. What's happened over the last 5 years for sure, but definitely over the last 10 years is when cannabis first was coming out, they called it indica and sativa. One was relaxing, one is energizing. But what's happened is cannabis plants are now being put together to create what they call cultivars or chemovars, which is the combination of the strain itself and the terpenes together. Both together will target, for example, sleep, or it will target pain, or it'll target inflammation. So what we're doing is we're now moving to what they call cultivars as opposed to strains. And the objective is to really find what you call your sweet spot, which is where do you, based on your tolerance to THC and your tolerance to cannabis, what's the right dosing for you? And really, that's something that you got to try and work on yourself.
Certainly. So, anytime that a patient is going to start using medical cannabis, we always talk about dosing because it's probably the most important thing that's going to affect how the medication is working for you. My biggest thing is I always tell patients you're going to start low, so at a low dose, and then go slow. And that just means anytime you're changing your dose, it's just going to be a small change, and you don't want to make any drastic changes at the same time. Um, the biggest thing with medical cannabis is it is completely different for each person. So what works for one person is not guaranteed to work for another person. So it's very individualized to that particular person.
Right. That's what makes cannabis unique. Now, we talked about the medical benefits of cannabis. It really comes from the terpenes. Keeping the terpenes and using those terpenes is really important. And there's a lot of terpenes. These are kind of the top 8, let's put it that way, that are out there.
Certainly. So cannabis has over 400 known terpenes, and we're just featuring the top 8 right now. But terpenes are really what's providing cannabis the smell and the taste of the plant, and it really is what brings a lot of the healing abilities of this plant. So if you look at a terpene like limonene, this is great for elevating your mood, relieving stress and anxiety, improving absorption of other terpenes, anti-inflammatory effects, and it has also been shown to have some antioxidant properties. Now, limonene, obviously, as the name implies, you probably know this smell already. This is what you smell when you smell citrus fruits like limes and lemons, and it has this very bright smell to it. So it's something that people are already familiar with. We're just giving a name to it and just identifying it in another plant.
The pinene is interesting because it's that analgesic property. It's probably the best for not only stress and anxiety, but also for pain. It's one of the keys that's there. Now, my caution with pinene is it does help bring back short-term memory. If you're using it and you have PTS, I would limit the amount of pinene you're using. But that being said, it's still one of the most important terpenes in the cannabis plant.
Certainly. And I mean, that brings us right on to linalool. So, linalool is probably very familiar to a lot of people. This is what gives lavender and coriander their kind of sweet, floral, spicy, musky smell. But it's really great for elevating mood, reducing stress and anxiety. It can be used as an anticonvulsant, and it has analgesic effects, which is pain relieving effects.
Oop, back here. Myrcene is really important. In fact, myrcene is probably the most popular terpene that you'll find in cannabis itself. Almost every variety of cannabis cultivar has some sort of myrcene in it at some quantities. Really great for inflammation, really sedative. It's something that relaxes, muscle relaxant, helps with stress and anxiety. And what's interesting is it has this taste like mangoes or lemongrass. There's something about eating mangoes and using cannabis that's important.
Yes, so some people believe that if you eat mangoes before or while using cannabis, that it can intensify the effects of the cannabis because you're having that extra dose of myrcene from the mangoes.
Now, caryophyllene is, again, one of the primary and most important products out there for pain and also for inflammation. It's something that's been very, very shown to have not only those properties, but also help with stress and anxiety.
Certainly. And beta carotene is going to be that earthy, woody, spicy smell that you might get from black pepper, cloves, or hops. But like you said, it's really great for its stress relieving and analgesic properties.
Right. One of my favorites is eucalyptol, which helps with things like blood pressure, antifungal, and also helps with sinus infection.
It can, yeah. And it's going to have that fresh, minty smell that you might associate with eucalyptus or bay leaves.
Yeah, and it also helps with dementia. Humulene is not necessarily one of the most popular, but it is one of the most important from the standpoint of anti-inflammatory, and also it helps as an appetite suppressant.
It can, yeah. And when we say that it's not as popular, what we generally mean is it might not be found in high quantities in cannabis plants naturally.
That's a good point.
So it's more of a minor terpene.
Right. And terpenoline is also key. It's great for not only mood, but also the antifungal, antibacterial, antioxidant parts that are there. And this is one that addresses the proliferation of cancer cells.
It can, yeah. It can help reduce or slow the proliferation of cancer.
Right. And I should point out that anytime you're using cannabis, you always have to be concerned about the temperature if you're vaping. And notice that all of these are a low to medium vape. And we'll talk about that in a little bit. But when you talk about how you can take cannabis, this is what makes it different from a lot of medications. You have really oral, sublingual, inhalation, topical. Amy, tell me a little bit about these, because really you can pick your poison with respect to which one you want to take.
You can. And the biggest thing is I always talk to patients about finding products that they're comfortable using. If you've never been a smoker or vaped at all, vaping might not be something that you're interested in, and that's okay because there are a lot of other routes of administration to consider. So maybe you would consider a tincture, which is an oil-based product that comes with an eyedropper to measure it, or you might be more comfortable using a product like a oral spray or even edibles. It's just finding that particular product that works well for you and that you're comfortable using.
And also there's what they call an onset time and a duration. How long does it take to work? So for example, if you use a tincture, which is you put underneath your tongue and it helps gets absorbed by the blood vessels, it may take 15 to 30 minutes to work. In my case, about 20 minutes, and it'll work for 4 to 6 hours. That's here. Where if you take a look at some of the oral products, and this is where I just say when you get into edibles like gummies and chocolates, be very careful because they say it's 30 minutes to 2 hours. Sometimes it's closer to 2 hours to work. About the time you think it's going to work, it's not working. Is the time you take another one is when it starts working.
Yeah, and that can be uncomfortable if you take more before you've allowed the original dose to work. And that can lead to, feeling like you took too much and like you have that high, heady feeling that we actually want to avoid in medical cannabis.
Well, and what the real reason to use it is, for example, I'll take chocolate before I go to bed, and it'll let me sleep through the night. It helps me cover about 8 to 10 hour coverage. Or if I use a sublingual drop, I'm really looking at 4 to 6 hours. I'll wake up at 2 or 3 in the morning. So there's a place for oral, and like I said, the only thing you have to be careful of is just be cool. Just be cool with it. Now, inhalation, very popular, where people use flower, vape pens, and concentrates. The onset is immediately, and it can handle it from 2 to 6 hours. But there's some issues really related to, why do people use vape pens versus flower, right?
Certainly. The biggest thing is when somebody is using flower in a traditional form that you might recognize, like a pre-roll, like a joint, or in a product, in something like a bong, is you are going to lose a vast majority of the medical properties of that by combusting the product. So it can be very beneficial to use something called a dry herb vape. This heats up the flower and allows you to inhale all of the different terpenes, cannabinoids, and flavonoids before they've been burned off by the high temperatures of actual combustion.
Yeah. That flame that you use to light that joint at 500 degrees burns off half the cannabinoids, all the flavonoids, and all the terpenes. Where if you use a dry vape vaporizer, you can actually set the temperature. For example, at 340 or 350 degrees, which is ideal. And let's not forget topicals.
Yeah, so topicals are actually very effective. Some of them will go into your bloodstream. Some of them will be just localized relief to wherever you put them. It's just checking the packaging to check if it will go into your bloodstream or if it's just localized relief. The very nice thing is the onset time is almost immediate. And then generally they last for a couple hours. So if you need something to help you get over those humps in the middle of the day when you have some pain or irritation, then you can just use this product and it will help you get over that hump.
And what's important is you can mix and match these during the day. So for example, when I wake up in the morning, I have herniated discs in my neck. I have 7 of them, which is a lot of pain. I can be in a level of pain of up to 7 when I wake up in the morning. I'll grab an inhalation pen. I'll take a hit off that. Within a minute or two, literally the pain level will drop down to close to a 1. I also then take a sublingual drop, because what that'll do is gives me 20 minutes to 30 minutes. It'll last me through the morning and the early afternoon. In the early afternoon, again, I do another sublingual drop, although I might do something oral, depending on the day and what I have going on. And then in the evening, I'll do something, again, after dinner, to be able to handle it through the night. And then when I get to bedtime, that's when I do the chocolate. In my case, the herniated disc is not going to go away. It's not something that I can turn on and I wish I could turn it on and turn it off. But by being able to have a regime that covers the whole day, it lets me use the various types of administration and be able to handle the pain and be able to manage it, which is important.
Absolutely.
Now, we talked about dosing earlier. We're not trying to beat a dead horse to death, but dosing is absolutely critical. Really, it has to do with the fact that everybody's body is different, and we see that with things like alcohol and caffeine. Some people can have one drink and they're done for the night. Some people can drink the whole bottle and they're just getting started. Same thing happens with cannabis, but the same thing happens with pharma drugs. Is you have to really get the dosing correct. But in cannabis, you control the dose, and that's the key. You are in control, and you can be able to split the go low and go slow. That's pretty good advice.
It really is good advice, and it's just to help patients find that sweet spot where they have the relief that they're looking for without unwanted side effects. And truly, that psychoactive, heady feeling is the side effect that we're trying to avoid. So we want to try and find that dose where you're having the relief, but without the side effects.
So you might start with 0.5 if you're using a tincture drop, for example, 0.125 or 0.5 milliliters. Try that for a day or two. If you don't feel anything, go up to maybe 0.5. Try that for a day or two. Go up to 0.75. And you'll feel it. Your body will tell you. You'll begin to feel the relief that's there. And when you go over that, when you take too much, your body will also, you won't feel as comfortable, which is what you're talking about. And so that's when you back down.
Certainly. And it works just the same throughout the day. So if you are feeling, a little bit more pain throughout the day, you can increase your dose slightly. Or if you're like, hey, I feel pretty excellent right now, you could decrease your dose if that's what you need right then. And that's okay. Because there are no chances of overdose, you can safely increase your dose. And because there's no chance of withdrawal if you stop suddenly, you can totally decrease your dose if you want as well.
Yeah. So it's very important. This is really key to medical cannabis. You are in control and you know exactly what to take. Now, people start with a 1-to-1 ratio. When they find out what their THC tolerance level is, you can then stop there and actually start to increase the amount of CBD. You go to a 2-to-1 or 4-to-1 or 20-to-1. My wife, for example, uses a 12-to-1, 12 CBD to 1 THC. That's what works for her.
Absolutely. And it is finding that specific product that works well for you.
Right. It's there. Now, we've talked a lot about cannabis. What's the bottom line? Amy, it's safe.
It is safe. So again, there's never been a reported death associated with cannabis. It is safe. It's safe to use in all of the forms that are available commercially, whether that's oral products, inhalation products, topicals. They are safe.
Right. And you're not going to get addicted. And more importantly, you're in control.
Absolutely. And this includes you are controlling the dose. So if something isn't working for you, you can find a different dose. You can find a different product to find. It's about how you feel using the products.
Right. And again, you have the entourage effect that comes into play.
Certainly. And this is, all of the different parts of the cannabis plant working together to provide these benefits.
Cool. Well, Amy, we've talked a lot about cannabis. Let's answer some questions.
Absolutely. Let's do it.